Today we're celebrating, really. As I said earlier, a young lady who came to Xavier who had never seen a black doctor before she came and left here, went back to a minority village and served a minority population that didn't have health, and then rose to be the 18th Surgeon General of the United States. If that's not a great story, I don't know where there was one. And that she now comes home and is going to create a new generation of young people just like her, who are first generation, who want to make a contribution and will be inspired by what she has done. And that's very important for all of us.
I think having her here kind of brings more recognition to our university and our public health program here. I think kind of inspires us that we can go out there and do great things like she did. She came from this university and we can be the same. We can go out, become leaders in our own community, in our own country, and on a global level as well.
I'm so excited to accept the position of endowed chair in the NOLA.com Times-Picayune Endowed Chair in Public Health Sciences here at Xavier University of Louisiana. It's exciting. It's all the opportunities that come with it. Being back home at my home institution is exciting, and having the excitement in the room today here. The main thing is being able to continue my passion for health and wellness and prevention. As Surgeon General, I chaired the National Prevention Council that established this national prevention strategy. And so prevention has been the foundation of my work as Surgeon General. I am now able to continue that. I stepped down a few months ago from my position, but not from my mission. And I want to continue my mission right here at Xavier on a national and international level as well. The most exciting part is having the opportunity to shape and to be a part of creating the next generations of future public health leaders.
Good morning and welcome. This is an exciting day for Xavier University and the city of New Orleans. Today we welcome home, I guess I should say, a loving daughter and a favorite friend combined. We welcome the 18th Surgeon General of the United States, Regina Benjamin, to the university as the NOLA.com, the Times-Picayune Endowed Chair in Public Health Sciences. That's big. As the 18th Surgeon General of the United States, Dr. Benjamin was the American doctor, and now she will be here to prepare, to inspire, to encourage a new generation of healthcare professionals for this region and this nation. She has tirelessly worked to improve the health of this country, and she will continue her work, important work at Xavier, with her legendary commitment to people, particularly those who are most in need of health care. In addition, though, she will also foster a number of different initiatives, including hosting healthcare conferences and research, national and international. For an example, she will certainly call to this city people from all over the world to talk about smoking cessation. I have someone in this audience who's passionate about that, who is the president of Ashna Hospital, Pat Quinlan. Happy to have you here. And she will continue her important work on America Walk campaign that highlights the importance of walking for individuals and whole communities. With her strategic vision, Dr. Benjamin will assist the Public Health Science Department at Xavier and our existing partnerships to maintain and attain national and international visibility. We are all aware that the United States faces enormous health challenges ranging from high chronic disease rates, environmental health threats, limited disease prevention programs, and a limited health care in urban and rural areas. With Dr. Benjamin's experience and passion for health care, Xavier will continue to serve and enhance our important role in producing leaders to meet demands for public health professionals. Xavier's founding and continuing institutional mission is to promote a more just and humane society by preparing our students for quality leadership and service. Through the university's teaching, research, counseling, and culture, Xavier graduates are prepared as well for continued spiritual, moral, and international development. Dr. Benjamin's care, not only of her patients, but of the entire American population, embodies the university's mission as an example of how Xavier educates the whole person. It's so interesting that we are a liberal arts college, but we are producing the highest number of young people who go on to medical school. For her career provides numerous examples that Xavier students can use to grow personally, spiritually, and professionally. Her example of working under the most adverse circumstances to deliver health care without compromising quality will teach students to use their knowledge in critical and creative ways to better their communities. She left here with her little bag on her future fame and fortune to wind up in Bayou La Batterie with fishermen and poor people who didn't have money to pay, but they provided the finest oysters and shrimp that anybody would ever want. Xavier's legacy in the United States, as I've said earlier, as a leading producer of African Americans who complete medical schools, become pharmacists, and graduate in biology, physical sciences, and pre-med will continue. Our students have a true desire to learn more about public health fields to include behavioral science, health education, health care and administration, and environment health. Dr. Benjamin believes, as we do, that public health courses should be offered and available to all students and taught with vigor and pride. Today, for all of us, today portends an opportunity we welcome and one we will honor fervently. I'm happy to say that we have produced the healthcare workers and the like, but we've produced a lot of lawyers, mayors, and the rest. And sitting in the front row is the councilman for our district, Ms. LaToya Cantrell. LaToya, welcome. I want to now express our thanks for this endowed chair to the NOLA.com, the Times-Picayune, and the Louisiana Board of Regents for funding over the past 6 years this endowed chair. We have been waiting a long time, and if you want to know what faith is all about, today is faith, because we believe that this day would come, and here we are. And now it's my pleasure to introduce Dr. Calvin DeSalvo, who is the City of New Orleans Health Commissioner and has served as the Senior Health Policy Advisor to Mayor Mitch Landrieu. And since assuming this office in 2011, she has led a major transformation of the City Health Department into a modernized one with improved effectiveness and efficiency, capable of improving the public health where they live, where they learn, where they work, and where they play. Dr. DeSalvo.
Well, good morning, everyone. What a fantastic phone call that I received when I learned that my old friend and colleague, Regina Benjamin, would come home to Louisiana to lend her considerable talents and experience and passion to public health to make this a healthier place. For me personally, it's really wonderful that I know she will join a vibrant public health community that isn't traditional in many ways. It includes really forward-thinking politicians like my own boss, Mayor Landrieu, and Councilwoman Cantrell, who chairs Health and the HES, which I can't even say, Health Education and Social Services, and has been a great partner in health. plus a host of other folks who are all in the room. Louisiana Public Health Institute, the Schools of Public Health at LSU and Tulane. I'm just really excited to see how many people have come forward to welcome Dr. Benjamin back to our community. And I know that her calendar will be very full very quickly because we all have much work to do, as was described by Dr. Francis. This is a community that cares, but a community that has challenges. And we have much work to do to move ourselves out of a position of need and into one of model. We've made really great progress, and I would say that some of that is due to the work of people in this very room, much of it is, as well as others who are on the ground every day. In fact, we have been making so much progress that we recently were recognized by the Robert Wood Johnson Foundation for making policy and systems and environmental level change to improve the public's health. So she comes at a great time to help us really accelerate that work. I just want to say a couple of personal things about Dr. Benjamin. I have had the chance to know her from our days of community health, even before Katrina, and she's always been a person who says yes, even if she's not sure she can, but she always finds a way, and it comes from her heart, and she always follows through. And so when I took the role as health commissioner in the city, one of the very first phone calls I made was to her, to ask her to help guide us and to help us see the big picture nationally and to send us any resources that she possibly could. And as you can imagine, she came through in all areas. She was always available to give me counsel, and I'm expecting that she will be able to continue to, but now over coffee instead of the phone. She has been able to send us resources a couple of times. We've had armies of public health service folks come down to help us with immunization records, to help us spruce up our WIC clinics and Healthy Start programs so that they were more friendly and workable for our clients. And most recently, last year, about this time, she sent us an army of folks to help with medical special needs for Hurricane Isaac when we needed to shelter those vulnerable populations, and she made sure that we had the resources that we needed on the ground. And so I thank her for that. So I'm going to conclude just by, again, welcoming her and hoping that I'm the first on her calendar before Pat Quinlan so that she learns about more than smoking. But we know it's a really critical issue. And I look forward to having her develop our workforce, help us reduce disparities, and make us one of the healthiest places in America. Thank you.